Hello, I'm Anastasia Kozlovski, and my topic today is about using figurines in a schema couple therapy. I come from Finland, and I've lived in Finland for about 20 years right now, and I'm teaching and training here, also at the University at Helsinki, and I'm also doing my private practice as a psychotherapist for both individuals and couples, and also for uh, students doing supervisions and working with adolescents. So I'll share my presentation, then you can follow me better with pictures. Let's see how it works. Okay, this is the first slide. Let's see. Okay, so happy World Schema Therapy Day to all of us. I will be really brief about myself because time flies and we have only 30 minutes and lots of things to cover. So, as I said, I'm based in Finland right now, and um, I'm certified in couples and in individual uh, work at the trainer and supervisor level via ISST, and also I've attended ISST program of doing schema therapy in children and adolescents. And I think that is why I'm so passionate about using figurines. So I got my inspiration from Christoph Loos. Thank you for inspiring me. Because they do use a lot of figurines and toys and creative methods in doing schema therapy in children and adolescents. And I think we adults and I think everybody deserves the creative methods, adults also. So I kind of just started doing figuring work with adults and just got really inspired by the results because most of people love this kind of way of working. Some people do not like, which is normal, but mostly people enjoy this work. So that's why I'm here speaking with you, kind of sharing this method. And I also wrote a book on schema therapy from theory to practice with my colleagues last year in Finnish. And uh, I train a lot here and also doing supervisions and doing my private practice with couples, individuals, and adolescents. And here is kind of my education. So I mix a lot of methods into schema therapy, but I think my main passion is chemotherapy. Uh, so that's why it's nice to be here talking to you. Okay, so let's go forward with the topic of using figurines. Here is the model that we use. So Eckhart Rediger's two-leg model that we explain to our couples, usually during a preliminary meeting that we meet, and we go over this attachment and assertiveness need and how could we fulfill it in a balanced way. If we're balanced and we're kind of in a healthy adult mode, this here we kind of integrated mode box. And then where when we hear mostly our critic beliefs, then we kind of try to do something else with with the needs. So if we're too much on the red leg and assertiveness leg, then we could try to dominate others. Or if we're too much on attachment leg, we tend to submit, or we just withdraw from the stress of life, and we could withdraw also kind of in a blue way, fearful, sad, or kind of in an active way, kind of fight away withdrawing. So here is this model, also the same kind of picture as here on the right, but with my figurine. So I would not go over this two-leg model in a detail because it just takes so much time, and we just cannot do anything more than so. I hope you are familiar with this model, or you could familiarize yourself with it via other trainings or videos. But here is how I map my figurines to the model. How here is this basic feelings, kind of child modes and schema therapy. This vulnerable child and scared child, and here's this discussed anger, uh, basic feelings. So this is angry child, an impulsive child, figurine mode, and here are this happy child and healthy adult mode. Here, these are critics. This is this submission box with following surrender, kind of compliance surrender and helpless surrender being here. And here is this withdrawing figurines, passively, actively withdrawing. And here is this more kind of red dominance coping modes with bully attack, with self-aggrandizer, with a helpless surrender that is more red, more active, and also with over-controller, perfectionistic, and suspicious one. So this is what we go over with our clients first. And then briefly, I could also speak to you about those figurines and modes, but you very quickly so that we have time to go over our demonstration and the benefits and roadblocks of using figurines. Okay, so these are critic modes. I like to speak about three kind of parts of critic. So demanding one, then catastrophizing one, and punitive critic. So demands, 200%. 8 is not enough, and catastrophizing shows pictures of catastrophes to us, and punitive just calls us names, just punishes. Then there is this vulnerable child that is kind of a really important mode that we want to see in our clients and soothe it to be able to meet the need or the needs of the vulnerable child, kind of a child mode in us that is really precious. And then there's this angry child, which is kind of in a childish way angry. So, oh, it's not fair if I did get a promotion, or it's not fair if I belong here on the playground. I want to play. So it's kind of a nice way of being angry. When you hear people, an angry child, you kind of feel empathy for. So you kind of want to soothe them. And there's this impulsive child that just wants to do too much of everything. So too much candy, too much movies, and so on. It's kind of some healthy limits. Happy child is a nice mode, very nice mode to be in. We want to foster it, promote it in our clients and ourselves. And certainly adult modes are really important. We want to foster it too in our clients and ourselves. So this is the mode that kind of takes care of the needs of the child modes, of the basic feelings. So I have in my figurines repertoire the male figure, kind of the wizard guy, then this kind of a female with flowers, and then the sex neutral figuring of picturing of adult modes. Okay, then if you remember this two-leg model, the left box there in the down below. So it's a compliance surrender that is thinking about others, not remembering itself. So kind of gives whatever it has to others just to get attachment, to get the feeling that I'm accepted, I'm accepted into some group of people. I'm here, not alone with others, but forgets itself, kind of submisses too much. And this is avoidance box from the middle. if you remember the two-leg model. So a kind of spaced out protector is more dissociated one, and detached protector is more mild one. But it's kind of a passive way of not feeling the feelings. There is this more active way of not feeling the feelings, so just kind of really detached self-soothers, soothes himself with, for example, alcohol or gambling, watching too much movies, or doing too much sports. It could be whatever. Doing too much of something, just not to feel the stress of life, not to be in touch with vulnerability. And then there's this angry protector kind of mode that is not really doing anything mean, but looking so scary and so angry that everybody is afraid of approaching them. Keep away is the message. And in the right below box, if you remember the two-leg model, when there is this dominance coping mode box, there is this bully and attack coping mode that is shouting at each other and being just mean, just not just looking scary, just act scary. Usually could hurt physically or verbally the other. Then there is the self-aggrandizer. I'm a queen, I'm a king, I'm just so special. And here is this perfectionistic or suspicious over control. It tries to control, dominate others by controlling them to have some sense of, safety by that, being really dominating and red. And there is this pseudo vulnerability, which is quite a new mode, I think. I think it's Susan Simpson that introduced it first in a eating disorder population. So it kind of looks like a vulnerable child, but it is not a vulnerable child. It is a coping mode. So it's a kind of when you try to help them, the people in this mode, they just say, no, 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 it just doesn't work for me. Okay, maybe for the others, for me, it doesn't work. So they kind of are stuck in this vulnerability, but it's more kind of instrumental vulnerability. It's not vulnerable child. So we have to kind of bypass these models. So I like for you to see some small demonstration. How can we use figurines in a setting with couple? So I'll stop sharing for you, and so that you can see myself and the figurines. Okay, so welcome to my therapy room. If we have, for example, a couple that is called Alice and Jack. So here's this. Alice is a healthy adult, and Jack's healthy adults that brought them to the couple session. Okay, and if they have kind of the cycle going on between them, that for example, they agreed on cleaning, and then when Alice came home, then she kind of noticed that Jack didn't clean at all, although that was agreed on. And that is why she was really triggered and kind of was shouting at him, how can you be so not thoughtful and just not think about me, and just was in a bully and attack mode, attacking him with mean words and everything, that okay, it's horrible, you're a horrible person for not cleaning as you promised. And then certainly when this kind of like attack and bully mode and energy is directed at you, then usually it doesn't feel nice. And then Jack, being a really kind of sensitive person, just withdrew. So he felt overwhelmed, and he just went to his room and shut the door behind him. So if you see this kind of couple with this kind of mode cycle, then you could map it like that using figurines and chairs. So you could for example, model the cycle that, okay, do you see, Alice, that when you're so active, so kind of really dominating and shouting and calling him names, then he gets overwhelmed and kind of his brain cannot probably think straight, and just the only way he can do is just protect himself, and close himself in his room, just to not to be exposed to this kind of shouting mode of yours. And do you see that, if you shout and if you attack, then he withdraws, and then the more he withdraws, the more you kind of your vulnerable child feels not seen and not important, and it fuels your anger. And the more angry you get, the more you shout. The more you shout, the more he withdraws. The more he withdraws, the more you shout, and that is kind of never-ending cycle that is not good for anybody of you or not for your relationship. So that is really important to kind of do time out and to stop this kind of cycle from going on, and to kind of look what the child modes and their needs are, and what we can do about it, because those coping modes are not helping to engage kind of more adult way of being here. So if they kind of agree, okay, that is our cycle, and yeah, that is logical what the therapist says, that okay, we kind of have to cut out the cycle from happening, because it doesn't help anybody. So then we could work next. Then we could also introduce the critic mode that you saw in my picture. If Alice, for example, would have some kind of background that she grew in a family where mother was doing too much work, and kind of was really absent physically, and father was drinking alcohol and was like uh, emotionally absent, and sometimes father was also kind of really verbally abusive. So probably in this situation, the scaring, catastrophizing critic would come to Alice and say to her vulnerable child, you're not important, you're not loved, you're not worthy of love, nobody will love you, everybody will abandon you like your parents. So then Jack is the same, so he doesn't love you, he is just abandoning you and doesn't care about you. Okay, so if her kind of vulnerable child really believes that, okay, that is the truth, the ultimate truth and only the truth, then certainly it is understandable that, okay, now the only way of being temperamental person, she's kind of red person by temperament, so the only way I can do if I get abandoned anyway, then I just shout. I at least try to get heard, uh, to get to be listened to. So this is why her Boolean attack engages to try to protect the vulnerable child. So it is very important if this critic is there, kind of exaggerating the facts and catastrophizing and giving her no other options, then the healthy adult would come and say, critic, you're totally wrong. You're speaking from the childhood, from your schemas. She is the adult person. Jack is not her father and not her mother. Now there is other possibilities. You don't have to engage. The bull attack, it just perpetrates everything and forces your schemas to come true. That is important. And also in a way of Jack, when he grew up, there was this mother that was really kind of demanding, like the demanding critic, demanded really excellence in studies, and kind of also really punitive, like if he didn't do homework good enough, so she would really call him names. So probably in this situation, when he sees that his wife is attacking, then his critics also activate and speaking to his vulnerable child that, okay, you're not good enough, like your mother said, you're just a loser, a lazy person, you cannot even clean, so you're not good at husband and you're just a loser. And when he believes, okay, that is the truth and the only truth, the ultimate truth, then he also doesn't see any other option to behave other than just retreat to his room, at least to be safe from all the stress. So it's really important also that his health adult would show up and say, okay, that is the bullshit that you critics, speak to me. It's the schema language. It's from my past. I'm not the boy anymore. The Alice is not my mother. Okay, get lost. So, and you, detached protector, you do not help. You just perpetrate her bully attack. So please, thank you for your service, but you could go on a vacation. Thank you. So that would be important for him to for his self-adult to say. Then we could also map, okay, is it more that Jack is in a blue leg, kind of as a more person, more reserved temperament, and he kind of needs to activate the red leg to say to Alice, so dear Alice, I love you. I want to be with you. I want to hear you. I want to listen to you. I want to clean when I promised. I just forgot. Sorry, but this bully attack mode of yours, it really scares the of me. It is really kind of scary, and I cannot think straight when it shouts. Please, could you, in a more calm way, say what you need or what you feel, and then I will listen and I will do my best. I want to be with you, but I cannot be in the same room with this kind of really scary mode. Okay, so he would activate that, and then also the Alice, when she's more kind of temperamental person, more like reddish one, like her father, she's more on an angry leg. So she needs to activate more this vulnerable child who doesn't want to activate. It falls apart. So she has to kind of be more vulnerable and share this vulnerability that, Jack, I really, you are important to me. I really get scared. I really get scared when I notice that you do not do what you promised. So I get this critic attack that nobody loves me, you don't love me, and then I get scared. Please, could you not withdraw from me and just be with me here and just talk to me and say that I'm important, and we'll talk about cleaning or whatever. I want to be with you. You're important. So that is more kind of from a blue leg and balanced message from both. So this is the situation that we want couple to be in. That is what we foster here, and that is how these figurines could map what is happening and what we could do. I hope you got some idea how to use the figurines, and then we'll get back to our presentation about benefits and roadblocks, because we have some minutes left. Time really flies so quickly. So if we will think about the benefits of using figurines, then I think there is this shared visual language and externalization that is, I think, nice about figurines, because it's just so much easier to talk about modes being there on the table, not to talk about you being in a mode, and not to talk about person, but just about the mode. And also, makes modes concrete and separate from the person if you use figurines, I think. Then it's just more about emotional regulation and safety. So it kind of, some offers some distancing, some titration to keep arousal in a window of tolerance, which is, I think, really important when, you have high conflict couple that are really kind of furious. So also, I think the benefits are that there is this empathy and mentalization that we kind of foster in mapping the cycles and what's going on using figurines. So it's nice to kind of mentalize what the child modes want, what they need, and what's going on there behind the scenes, behind this cycle of attacking and withdrawing. Okay, then assessment and formulation. I think it's a nice tool to kind of assess and formulate what's going on. to kind of do a rapid mode inventory, what kind of modes you were in, and to kind of suggest some possibilities. And also for skills practice, you could, try to speak from the vulnerable mode now, try to speak more from the red leg and stuff like that. So you can kind of rehearse these issues and these ways of speaking from healthy adults, for example, or empathic confrontation with coping modes, or with critics, and with critics confrontation, not empathic confrontation. Okay, then there is this possibility of structured communication, speakers mode of then you could take photos and use it as learning and memory tool between the sessions, and kind of you could also get more engagement and motivation in kind of playful way that lowers usually the resistance of couples in my practice. At least I notice it. And then it's nice just to kind of keep the focus what's going on here on a model on a schema level, and to do it more kind of for both, not to take sides. And then telehealth readiness, it's really, as I'm doing here, it's easy to do it in a telehealth session, and to share photos also. Then about roadblocks, we have a couple more minutes. So some people think that it is kind of childish, or kind of, they're really skeptical about using toys. So then it's just nice to reframe that, okay, it's a tactical map. It's not a toy. It's a metaphor. What's going on? If you don't like it, we don't have to use it. Okay, we could use the whiteboard. It's okay. Then somebody could feel shame and embarrassment. Okay, it's horrible. I'm so shameful person. I'm in a bully attack mode. It is so horrible. Or I withdraw like a child. I cannot stand my wife when she has feelings and stuff like that. So then it's really important to kind of normalize. Okay, everybody has those modes. It's okay to be in a mode sometimes. We can do timeout. We can breathe the fresh air and then get back with healthy adults. So it's okay. Therapist also has those modes. It's really totally normal. Okay. Then could be the problem that the client says, I don't know my modes. Then you just offer some possibilities. Just try to kind of think together about some modes, and think, does it match the person's opinion. Okay, then there could be overwhelmed, too many pieces. Then you could just cut to the child modes and health adult and some coping modes, and do one chunk at a time if they get overwhelmed. Then there could be labeling and language barriers. Then you could label them to write how they code. Could be trauma dissociation, grief activation, too much. For example, some figuring could mean too much. Then, you could titrate to ground, opt out anytime. Could be symbolic cultural concerns. Okay, then you can replace figurines. Could be perfectionism, performance anxiety. I have to, do a perfect mapping. You don't have to. You could emphasize good enough mapping. And then there is this escalation during mapping. Then, okay, use timeout, emphasize health adult. And then access privacy logistics. Okay, it's important to share photos without any patient name or material. But thank you very much for your attention. I noticed that time flies very, very fast. I hope you enjoyed the presentation and got some inspiration using figurines. Thank you very much, and see you in the conference in Thessaloniki. Bye-bye.